So, Jaisha, after the baby, a lot of women go to like postpartum depression. What is a postpartum depression? And if like postpartum depression happen, what was woman should do? And then postpartum depression happen in the joint family too.
So the thing is, it widely used nowadays, the postpartum depression, but it's not that common. The most important thing, the most common thing is the postpartum blues, which occur in 85% of the women after the birth of the baby, and it's basically the overwhelm feeling, like the mother after the birth of the baby, she feel overwhelmed, like overwhelming, joyful, or maybe like teary, because you have to take care of a baby, which totally depend on you. You have to sacrifice your sleep, your hunger, you are not taking care of yourself, so it's kind of like you are doing something for the sake of somebody other. So it's a postpartum blue, which usually like go off in a week. Then in 10 to 15% of the cases, the women undergo the postpartum depression when there is a change in the sleep, lack of interest in the thing, like woman is not taking of herself, there's a change in the appetite, weight change, there are some suicidal ideation. That will go, and that can start for like up to 2 to 3 weeks. So that's the depression, and you have to like get help on that scenario. And the last thing, like only 1 to 1.5% of the patient go undergo the psychosis, in which the woman feel like the baby is evil, and she trying at that stage the baby have to be like taken away from the mother, because she can harm herself or she can harm the baby. So that's these are very important, and every woman should have awareness about these terms, because most of the people have the postpartum blue and they confuse it with the postpartum depression. Well, the postpartum depression is not very common. And the second thing is, if the woman have a history of psychiatric history, like she already have the depression, there are a lot more chances to get the postpartum depression too, and it can last up to like a year. So in the joint system, that really common in our society, in the east side, especially in the South Asian communities, there's a lot of thing happen in the joint system. I personally don't like this joint system, because there
Me
is a
too.
lot of because there's a lot of people and a lot of perspective. When a woman undergo a pregnancy, everybody is different. Every person, every woman react to the different situation in a different way. And in the joint system, because every mother have a different experience, she compare her experience with the person who is getting pregnant. And like it's not good, like if anything happened to you, or if anything you did